Hello, I am Donna Feeney, and I am this organization's compliance officer. During this age of healthcare reform in our country, I am committed to this hospital and making sure that we uphold the utmost trust from our community, our patients, and employees by being a leader in compliance. What this means, as I plan to incorporate the four things that are imperative to this hospital's health and welfare: transparency, accountability, compliance, and training. Tact. I plan to make our hospital transparent with our new AQRS system that gives us accurate and up-to-date data and reports on our patients. We are accountable by utilizing the systems our organization has put in place to identify overpayments so that they may reimburse either the patients or organizations in a timely manner. As a hospital compliance officer, it is my job to make sure staff and myself understand our broad scope and responsibilities. Training of our providers on the quality care of our patients will also be something I intend to tackle. Some of my many intentions to work with minorities or those with significant health disparities are outlined here. Socioeconomic status is an important factor in determining a patient's health status, health outcomes, and access to health care in our region and across the United States. I plan to implement within our organization during the month of October every year. We will offer free mammograms and pap smears to women in need throughout our communities we serve. The organization has also awarded a program and has started implementing nurses to the streets, which will help to ensure many homeless people in our communities will be monitored for illness and given the opportunity to care such as medications and vaccinations. Also, our organization is implementing free immunization clinics for adolescents and children who are in need of immunizations but cannot afford them or do not have government assistance. Diabetes is a huge social economic problem. Diabetes education is something as a compliance leader of this organization that I am very passionate about. This will have to involve our providers and ensure they are following the quality guidelines for health maintenance screening in regards to our diabetic patients. If we can proactively engage our patients in diabetes education, including frequent PCP visits, checking vitals, their feet, semi-annual lab screenings like hemoglobin A1C, these lab screenings to monitor their glucose and their kidney functions, getting annual eye doctor visits, and education on nutrition, we will have better patient outcomes. GINA, Genetic Information Non-Discrimination Act. The enactment of GINA declared a national policy against discrimination in health insurance and employment, which is based on genetic information. As this organization's compliance officer, I intend to educate and make accountable our human resource department and hiring managers to uphold the law of GINA. GINA does still have many risks. First, GINA can increase the stigma that comes with genetic conditions by treating genetic information differently than health information. Second, people convinced of GINA's ability might have predictive genetic testing and have their screening results leaked to current or future employers. The Stark Law. Stark Law comes with many penalties: denial of payment, refunds of collected amount, penalties of up to $15,000 for each bill, penalties up to $100,000 for each arrangement, fine of 3 times the amount improperly collected. The Stark Law prohibits a physician from making a referral for health services, including for which payment may be made under the Medicare or Medicaid program. If the physician has a financial relationship with the entity that provides the health services, as this organization's compliance officer, I plan to educate our providers and staff across the organization about the legalities and moralities associated with the Stark Law compliance. Some strategic alternatives. Organizations must be competitive, implementing a strategic plan with the new underlying financial pressures to continually reduce costs. Addressing the challenges we face now and in the future is necessary. Strategic alternatives will allow the leaders of a healthcare organization to have a greater control or influence over the external forces. This will help steer a healthcare organization toward a brighter future, even though there are many uncertainties that will lead ahead, including healthcare reform, industry change, and adaptability to these changes. As this healthcare organization strategically plans to make health services patient-centric by providing top-quality care, implementing better health information systems that are capable of implementing the most secure and accurate health data reports, all while supplying our patients an affordable product. As compliance officer, I will ensure our patients and providers act as a central point to guide this healthcare organization to achieve these set goals and objectives. Thank you.